Welcome to This Week in Urology. This week, we're covering 10 notable papers spanning major updates in prostate cancer management, new data on benign conditions like BPH and recurrent UTIs, and key considerations in complex oncologic and reconstructive surgery. Let's dive in. We begin with prostate cancer, where a major shift is underway in the management of metastatic disease. A commentary in European Urology Focus discusses the Phase 3 PSM addition trial, which evaluated the addition of lutetium PSMA 617 to standard first-line androgen deprivation therapy, plus an androgen receptor pathway inhibitor. The trial demonstrated improved radiographic progression-free survival by adding this radioligand therapy upfront. This marks a significant move, bringing a treatment previously reserved for resistant disease into the initial management of metastatic hormone-sensitive prostate cancer, though long-term data on quality of life and cost-effectiveness are still needed. For localized disease, focal therapy continues to gain traction. In the Journal of Urology, we have the initial results from the VAPOR-2 study, which assessed water vapor therapy for intermediate-risk prostate cancer. In this prospective study of men with Gleason grade group 2 disease confined to a single MRI lesion, targeted biopsy of the treated area at 6 months revealed only benign tissue in 75% of men, and either benign tissue or clinically insignificant grade group 1 cancer in 91%. The therapy was well tolerated, with a median PSA reduction of 58% and low rates of procedural morbidity. These findings support its efficacy as a tissue ablative option for select patients. For patients who undergo radical prostatectomy, achieving negative surgical margins remains paramount. A new International Delphi Consensus, or FCM, for real-time intraoperative margin assessment. Experts reached consensus on several key points, including a risk-adapted approach to its use, its role as an adjunct to MRI for nerve-sparing decisions, and a maximum reporting time of 30 minutes. This technology offers a potential alternative to frozen section, aiming to reduce positive margin rates and the need for salvage therapies. Turning to benign and functional urology, we have new long-term data for a minimally invasive BPH treatment. A combined analysis of 3 pilot studies reports 24-month outcomes for the ZenFlow Spring system. This tissue-preserving implant provided durable relief for men with moderate to severe LUTS. At 2 years, patients maintained significant improvements, with a 48% reduction in international prostate symptom scores and a 32% improvement in peak urinary flow rate compared to baseline. These results support its role as a durable missed option. In female urology, a large-scale database analysis from Urology provides compelling evidence for an established therapy in recurrent urinary tract infections. Using the EPIC Cosmos database of nearly 1.9 million women with recurrent UTIs, researchers found that a prescription for vaginal estrogen was associated with dramatically lower odds of serious adverse outcomes. This held true across all age groups, from 20 to 99 years. Compared to non-recipients, women who received vaginal estrogen had substantially lower rates of sepsis, hospital admission, and all-cause mortality. This powerful real-world evidence reinforces the protective benefits of vaginal estrogen, even in younger women, and should encourage its consideration in all appropriate patients with recurrent UTIs. And from the world of pediatric urology, a 12-year cohort study, also in urology, offers important reassurance for managing boys after hypospadias repair. The study followed patients from childhood to puberty and found that plateau-shaped uroflowmetry patterns, which can suggest obstruction, occurred in nearly half of boys prepubertally. However, in the majority of these cases, the flow pattern improved spontaneously during puberty without intervention. Only about a quarter of those with a prepubertal plateau flow required surgery for symptoms. This supports a conservative, watch-and-wait approach for asymptomatic boys with this uroflowmetry finding, potentially avoiding unnecessary surgical procedures. In the realm of major oncologic and reconstructive surgery, 2 papers highlight the importance of long-term surveillance and preoperative counseling. First, a multi-center analysis in the World Journal of Urology examined the risk of upper tract urothelial carcinoma after radical cystectomy. Of over 1,800 patients, 4.7% later required a nephroureterectomy for a metachronous upper tract tumor. These events occurred at a median of 29 months post-cystectomy, and concerningly, over 70% of these tumors were already muscle-invasive at diagnosis. Patients who developed upper tract recurrence had significantly worse cancer-specific survival. Key predictors included younger age, smoking history, and positive ureteric margins at cystectomy. These findings underscore the critical need for standardized, risk-stratified, long-term surveillance of the upper tracts following radical cystectomy. Finally, a review in European Urology Focus addresses urethral complications after masculinizing genital gender-affirming surgery. The authors emphasize that construction of the neurethra is the primary driver of postoperative morbidity, with fistulas and strictures being the most common issues. Procedures that include urethral lengthening are consistently associated with higher complication rates. This highlights the essential role of shared decision-making, where surgeons must carefully counsel patients to balance the desire for standing micturition against the substantially increased risk of urethral complications. And on a final note, a position paper from the EAU AI Working Group in European Urology calls on urologists to proactively engage with new regulations, like the European Union AI Act, advocating for the use of certified, indication-specific AI systems to ensure safe clinical translation. If you only have time for one paper this week, make it the commentary on the PSM addition trial in European Urology Focus. This trial signals a paradigm shift by successfully moving lutetium PSMA 617 into the first-line treatment setting for metastatic hormone-sensitive prostate cancer, establishing a new, more intensive standard of care. Here are the key takeaways from this week in urology. First, for newly diagnosed metastatic hormone-sensitive prostate cancer, adding lutetium PSMA 617 to standard ADT and an androgen receptor pathway inhibitor improves radiographic progression-free survival and represents a new upfront treatment intensification strategy. Second, in women of all ages with recurrent UTIs, prescribing vaginal estrogen is strongly associated with reduced rates of sepsis, hospitalization, and death, supporting its broad use. Third, patients undergoing radical cystectomy face a nearly 5% risk of developing a subsequent, often aggressive, upper tract urothelial carcinoma, mandating risk-stratified long-term surveillance. Fourth, in asymptomatic boys who have had hypospadias repair, a plateau-shaped uroflow pattern often normalizes spontaneously at puberty, supporting conservative management. And fifth, the ZenFlow spring system for BPH provides durable symptom relief and improved flow rates that are sustained at 2-year follow-up. That's your roundup for this week in urology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.